So I come across these headlines the other day saying that Dwight Howard is going to have butt surgery. I mean, like, it makes no sense. And since the whole point of this channel is to try to tease out some of the stuff that's going on with these sports injuries, in today's video, we're gonna take a look at Dwight Howard and his supposed butt injury. What's going on, everybody? My name is Brian, and for those new to the channel, I'm a doctor who's also a huge sports fan, and it's my goal in this channel to combine those two interests to help explain different sports injuries in a way that's easier to understand for the casual fan. I got a lot of requests on this one, and at first I thought it was just kind of a joke, everybody talking about Dwight Howard's butt injury. But then I actually looked into it and realized it's actually kind of educational topic to bring up. And so today we're going to talk about specifically this difference between piriformis syndrome and why you might have other causes of pain in the buttocks. So the initial reports were coming out saying that he was having some sort of gluteal pain or buttock pain. And at first we were told that his diagnosis was something called piriformis syndrome. Then it came out that he was having surgery to fix this diagnosis. But then the surgery they did was actually on the back with removing part of the discs in the spine. So what are these two things? How are they different? How do they overlap to maybe explain why Howard was having this buttock pain? So first, a quick anatomy lesson to help us understand piriformis syndrome. So piriformis syndrome comes from the name of a muscle deep in the buttock region called the piriformis muscle. And this is a tiny little band of muscle, only about that wide or so, very, very thin, that runs between the femur over here up into the sacrum. And so this is the backside. Your bottom muscle is kind of sitting right here. And this big yellow band coming down here is the sciatic nerve. In piriformis syndrome, there's some different varieties, but in general, what often is the case is that this muscle can get really, really tight to where it actually clamps and pinches on the sciatic nerve as the sciatic nerve goes behind it. So you can imagine if you pinch that nerve, you can have pain in the pattern of where that nerve is going, and that nerve travels through the bottom. So it's not uncommon when someone has piriformis syndrome to have pain in the buttocks due to that nerve, the sciatic nerve, being compressed and smashed. There's also piriformis syndrome where it's actually just the muscle that's affected and not anything to do with pinching the nerve. There's some anatomical variants where the nerve actually runs inside the muscle that can cause a bunch of problems. But in general, think piriformis syndrome, the piriformis muscle pinching on the sciatic nerve that runs behind it. Now, how is this different than what might be going on in the low back? And if you read ultimately, that was the surgery that Howard had, was a microdiscectomy to remove some of the disc fragments in the spine to ultimately help his pain. So back to our anatomy model here, these are the vertebral bodies, so the bones of the spinal column. And within that we have this yellow is the spinal cord running all the way down, and then these yellow structures on the side are the nerve roots leaving the spinal cord and going to the rest of the body. So if we look on the inside, you can see how multiple of those nerve roots come together to form a big nerve, the sciatic nerve. Now, in the case of a herniated disc, these cushioning discs between the bones leak out a little bit of the material inside them, similar to like a jelly donut leaking some of the jelly out. And they can compress the nerve in that tight little space in there, if you can see. So the disc herniates, material pinches in that nerve, and then because you're pinching the nerve, you can get pain and impaired function in the distribution of that nerve. And well, that nerve, like we said before, runs through the gluteal region. So it's certainly feasible that he could be having pain in the buttock region because one of his discs up in the low back was impinging the nerve root as it exited the spine. Obviously, the treatment paths are completely different. In the case of piriformis syndrome, you're focusing on that piriformis muscle focally and trying to relieve the tension as it's putting on the nerve passing behind it. Whereas in the case of if it's a herniated disc, you're going in and you're trying to do something completely different. And in Howard's case, they actually went in and did a surgery to remove the part of the disc that was pressing on the nerve. So who knows what it actually was that was going on, whether it was the piriformis muscle or if it was always the problem in the back. It might have started as the piriformis and then they found something in the back. It's impossible to really know, but I'm guessing if they did surgery on the back that there was some sort of nerve root impingement that was radiating and causing pain in the buttock. So did he have butt surgery No, he didn't. He had surgery on his spine to remove part of a disc that had herniated out, likely pushing on the spine. Whenever you see those headlines about butt surgery and a butt injury, kind of a mixed message to what actually is really going on. While there certainly are muscles and different structures in the buttock region that you can injure that can cause problems and need surgery, typically it's from the nerves or some other nearby structure causing referred pain in that area. So hopefully he gets better. Hopefully that surgery takes care of the cause of his pain and he's able to get back out there on the court. That's it for this video. I hope that was a good brief explanation into what's going on with this idea of piriformis syndrome and herniated discs and why they can kind of overlap, and ultimately helping you realize that no, he did not have butt surgery. As always, thank you for watching these videos, everybody. Let me know any comments below, your thoughts on this video, other things you want to see in the future. Also subscribe, share this video with anybody you might think would enjoy it, and until next time, we'll talk to you later. Bye.